Now, when you're talking about targeted and like focal brachy, how often do you see that seen? Like, is that something you've commonly done, or is it?
It's something that is becoming of increasing interest. The results that we got, the 95 and the 99% disease control rates, were by treating the whole gland with a margin and making sure that any areas that were not appreciated on scans or by other biopsies or other means, those parts of the disease were treated. The surgeons have been doing some cryotherapy and HIFU, high-intensity focused ultrasound, and treating part of the gland and even lasering part of the gland as a way of trying to do something less than a radical prostatectomy. So people have been looking at radiation therapy in a similar way. And the very best tool of doing that, in my opinion, without question, is HDR brachytherapy, because we can treat a quarter of the gland, half the gland, the upper part, the lower part. Now, what are the outcomes going to be with focal therapy versus whole gland therapy? In all likelihood, there will be some patients who have disease that you don't appreciate, so the control rates of the area you treat may be just as high, but they'll probably recur in another part of the prostate. So it has to be carefully decided with the patient based on the data that's available. There's not a lot of published data on focal therapy yet, but it's a very interesting concept to reduce urinary and sexual function side effects.
So if you would like more information about anything we talked about, you can go ahead and contact our helpline team and they will be available to talk to you. The number is at our website, pcri.org, and you can look up other information on prostate cancer treatments. And if you like this video, go ahead and give us a thumbs up. The reason those thumbs up matter is because that lets Google know that this video is helpful to you and it can help other patients, and we get on a suggested video list. Subscribe to our YouTube channel if you would like more information in general about prostate cancer. We cover every topic we could possibly think of, and we hope you have a great week.